Don't get bit by those bed bugs. A good night's sleep might become next to impossible if a bed bug is constantly, or a person I should say, is constantly being bitten by bed bugs. Bed bugs have been a problem for many centuries, dating as far back as medieval times and classical Greek times, as these have been documented in various writing. Sleeping on an infested bed is one thing, but being bitten by a bed bug is a whole different thing. While a bed bug bite is painless and has an extremely low chance of transmitting disease, people with such problems are mostly ashamed about their issue. Many believe that a bedbug infestation is detrimental to a relationship and can cause psychological strain. Outside of mental anguish, bedbugs can cause physical harm. The question now is, how do you treat bedbugs and their bites? Those pesky bedbugs. Bedbug bites initially appear as large red wheals that eventually become a red mark. This mark can last for as long as 5 days, and the mark is also made in an orderly way, unlike the random pattern of mosquito bites. Characteristics of bedbug bites. Irritation, inflammation, and destruction of the local tissue occur. Allergic reactions that can happen immediately or in a delayed response kind of way. Orderly pattern of marks. These are all characteristics of bedbug bites. These kind of bites can not transmit harmful diseases, and their medical significance is only limited to itching and inflammation. However, the immediate treatment for the affected part is by washing it with soap and water. Scratching is strongly advised against, as this will surely lead to infection and possibly even require more advanced medical aid. Treating the infected area with ice or possibly special herbs is also recommended, as these will help speed up the healing process. Where's the herb? Herbal treatments are primarily used to control infections, stop itching or pain. In addition, these are used to improve symptoms, correct imbalance, boost the immune system, and increase energy. The body needs to be strengthened for better health and quality of life. Chinese herbs are advantageous because they can be used in combination with other herbs, depending on the status of the bedbug bite. Herbal treatments used with optimized herbal combinations are highly effective to treat the illness and address the symptoms. Below are some herbs that can be used to treat bedbug bites. Plantains, also known as the band-aid plant, ribwort, and pig's ear. This herb is a common weed of parks, driveways, and playgrounds. The 5 parallel veins that run on each leaf distinguish this herb from others. A broadleaf plantain can have a tall seed head and long, thin leaves, while a narrow-leaf plantain has a small flower head that looks similar to a flying saucer, and it also has long, thin leaves. A considerable amount of plantago species have leaves and seeds that people use as food or treatment for bedbug bites. Mud. This is the simplest and oldest poultice. A bedbug bite can be treated with powderized white clay that should be mixed herb tea. Clay can be stored anytime and will not likely contain fungal spores. Bed bugs or other insect bites that cause severe itching or pain should be administered with bland starchy substances such as arrowroot powder, grated potato and mallow root, or finely ground grains such as oatmeal or even rice. Fresh herb poultices. These are slightly more complicated to prepare than other herbs because a person must first chew it, then apply the substance itself to the bedbug bite. For the best effect, the poultice itself can be placed in an adhesive bandage or large leaf to keep it in place. Some examples of the poultice include platinum, wild geranium, comfrey, yellow dock, wild mallow, and chickweed. The best herbal leaves are those that come from willow, maple, oak, or hazel. These herbs need to be recognized properly before they are chewed. The most recognizable and safest to chew of all herbs are oak and maple. Leaves that are either slick or shiny should be avoided if one is uncertain about what herb should be used for the treatment. If the leaf itself is extremely bitter upon chewing, it is advisable to spit it out immediately.